Once we've actually been able to make a diagnosis of narcolepsy, then we need to treat it. So, Russ, what are the goals of treatment here in narcolepsy?
Well, we've talked about a number of the symptoms, so what we want to do is improve that patient's functioning. I think we want everyone watching this to be absolutely sure and clear that this disorder of narcolepsy can have a profound impact on a person's functioning, and we want to encourage everyone to ask about these symptoms, because the earlier that we can detect narcolepsy, the better we can change that whole trajectory of that person's life going forward. So we certainly want to improve on their excessive daytime sleepiness, and this can be tricky. I know we'll talk about different ways to do this, but excessive sleepiness and making sure they're safe in their environment and safe in what they do every day. We want to optimize their ability to learn if they're children. We want to make sure that they're keeping up with other kids and that they're able to participate in not only academic activities, but sports activities and other activities that they would enjoy doing, dancing or whatnot. And then we want to make sure that adults are able to maintain alertness at work so that they can function properly at work and do their job. And I think in most work situations, if you're found asleep at the job, that results in an immediate firing, and so it has an economic impact as well. Beyond that, we want to make sure that they can function in social relationships, in marriages, and in whatever relationships that they have, and that they don't experience some of these other symptoms that Dr. Avedon talked about, like sleep paralysis, which can be frightening, and this can be treated as part of an overall package of pharmacotherapy, the frightening dreams, the hypnagogic or hypnopompic hallucinations, we spoke about this epic dreaming and so forth. So all these REM phenomena can be treated and managed. I think something I think I'll reference you for, Dr. Thorpe, is that these patients never normalize. Despite everyone's best efforts to adjust medications and to do what you can for patients. We'll talk about non-pharmacologic treatments in a moment, but despite everything we do, the patient continues to still have to struggle and manage or balance times they want to be awake, activities that they do. And it's very difficult with today's, even with the advances in today's therapies, to make them feel like they're not experiencing narcolepsy anymore. They're always carrying this around with them.
How about safety in these patients? Is there a risk associated with narcolepsy?
Oh, there's absolutely a risk with, we could talk about the excessive sleepiness of motor vehicle accidents. I think that can affect, can be affected also by cataplexy. I've had some adult patients who were so upset at people cutting them off in the road that they couldn't pick up their leg to press the brake and rear-ended somebody else. So I think both the sleepiness and the cataplexy can, be a cause of safety accidents, either on the job or just in daytime functioning. The other issue is cataplexy. Dr. Avedon talked about, the full-blown cataplexy attacks where people go to the floor. There are certain situations where you just can't do that, or you end up in a lot of trouble if you end up in that situation. So both cataplexy and the sleepiness together, I think, really increase a number of risk factors.
Yeah, and there's a lot of jobs where people are at risk if they were to have cataplectic episodes or fall asleep while on the job. So one of the goals is we want to make these patients really not only safe to protect them, but also to protect others around them too.